So today we're going to be talking about how to do your reflection on the patient interview. Last week you would have interviewed at least one patient, maybe more. You're hearing about their experiences of being a patient with the health service in various guises. Obviously, part of the assessment is the reflective process on this, and we're going to give you a little bit of insight today as to how you should do it. We are going to look at the purpose of the reflective video to begin with. We're going to talk a little bit about the structure and what a good one should look like. Some ideas about what should be in it, and what you should do to get a good grade. I'm going to give you some practical tips for recording, although recording should be fairly straightforward. If there's any problems with that, let me know. We're also going to talk about professionalism, a bit of a reminder about the best professional way to act and professional way to be in these recordings. And we're really going to be focusing on, turning the interview into a thoughtful, reflective experience rather than merely just giving a description of what happened. So what is it that we're actually interested in this assessment? We're looking for you to show us that you have learned from the experience. What are we looking for? We're looking for learning on particular areas. We're thinking about anything that you can tell us regarding your own self-awareness. Maybe you learned something about your own strengths. Maybe you learned something about your limitations. Maybe you learned that there are areas of practice and of learning that you don't really know much about yet. Maybe you learned that just being young and inexperienced and on a program means that there is a lot to learn. You might have learned that there's limitations in terms of where your learning is at the moment. You might have also learned a bit about yourself in terms of what you assumed that this whole situation was going to be like. What an actual session with a patient like this was going to entail. Sorry. And any kind of emotions as well that you felt. Be interested to know if you felt anything. Listen to the patient's story. Be interesting to know how you dealt with those emotions. If those emotions might affect the way that you think about practice in the future. We're looking for you to reflect on insights into your own communication skills as well, and those of your colleagues, without naming them, obviously, but maybe comparing and contrasting the different ways that other people in the room manage to show empathy, to build rapport with the patient. Did you find that easy? Did you not? Did you find yourself being able to make eye contact and listen in a way which was empathic? Is that something that maybe you struggle with, or something that you could develop in future? We're also looking for something on professional development. Is there anything different that you would do next time? Maybe you won't get a chance to talk to a patient in this particular way again, but next time that you see a patient, is there anything that you will do differently? Was there different things that you'll say, different things that you'll ask, different ways that you'll act? We're also looking for, again, this professional aspect. So evidence of, you acting safely and ethically. In this instance, that's particularly about confidentiality. We're not looking for you to name patients in this situation. We're looking for respect for patients as well. So a reflection isn't a description of what happened, but it's what you've learned and what you'll change from it. Okay, so more on this. The reflection is not just a description. So a description would say things like, we asked the patient questions, the patient answered, and it went well. So a description is really what you were maybe prone to say on the day, or maybe if somebody from another SSC asked you what you did in the session, you might say this. It's just really a description, and it's too shallow. That won't provide really a good mark. A reflection is more what we want. Things like, I noticed that I interrupted the patient when I was anxious. which reduced depth because it meant that the patient didn't get time to talk. I noticed that I was very uncomfortable with silence and things like that. We also have this idea about a rule of thumb. You will have to give us a little bit of information about what happened, obviously. So about 20% of that, and most of 80% of what you actually say will be about meaning, change, and learning that you had. Yeah, if your reflection could be written without you being there, it is probably too descriptive. Okay, so if the reflection is about what I would see in the room as an observer, then it's too descriptive. What we want to know is what was going on inside your head, both in the room and afterwards. It's a fairly simple structure to use for reflections. You may have used this before, and you'll probably use it again in reflections in future. We use it for all kinds of things. It's 3 simple steps, and the steps are called what, so what, and what now. Fairly simple, fairly straightforward. It's another way for you to think about how to do reflection. In the what part of it, you might want to think about a few key moments, a few key instances and things now a few days later that you can remember from it. A couple of things that the patient said, or a couple of interactions that you had where there were highlights. Did the patient make you think about maybe incidences that you've seen in clinic before? Did the patient make you think about what it must be like to be somebody going through that process? Was there anything about their journey that particularly struck you? So you can have a little think and maybe jot down some notes on them. You might also think about one challenge as well, one thing that you found difficult, or you found difficult to understand, or something that you found hard to do during the session. So the next part of the process is, so what? Why did this matter? Why did this particular instant that you're highlighting matter? What did it reveal? So again, the patient talks about maybe their hearing about their diagnosis secondhand by overhearing a conversation between 2 healthcare staff outside of a room, for example. What does this reveal about the patient? Why does that matter? What does it reveal about you that you found that important? What does it reveal about your attitude towards professionalism, towards communication? Can you also think, does it link into any kind of professional learning or training or teaching that you've had so far? Does it make you think about maybe how you've been taught to take clinical notes in the past? Does it make you think about clinical interviews? Does it make you reflect on any teaching that you've had on empathy? Does it make you reflect on the personality stuff that we did last week? Does it make you think about the ways in which hospitals are set up and hospital rooms are physically set up so that there's sometimes just a small curtain between 2 patients, or there's adjacent rooms where patients are sitting to where doctors are talking? Did it make you think about anything like that? And then the next thing, the last point, is so what now? Is there anything specific that you would make changes in? Changes to your practice? It may be that you think more broadly as well, the ways that we as healthcare professionals can change our practice. We want to get quite specific in this, so we want you to think about how you know it has worked. And in what situations will you maybe have to keep changing your practice and keep tweaking it. This is a fairly short, structured process this, what, so what, and what now, and it can fit quite well into the video because it's fairly short video, that you're being asked to do. Okay, to think about the way that you are going to reflect, you can even write down some of these on a bit of paper and before you record your video, and think about what you would, how you would finish these sentences. We'll be looking for a few of these. I was surprised that something. I was surprised that the patient was so young when they were diagnosed, or I was surprised that the patient was so positive about their experience, because a lot of people aren't, and a lot of reflective stories are about the difficulties that people had, whereas the patient might have been quite positive. What does that mean? What does that tell you about maybe the way that we tell stories as healthcare professionals, for example? I assumed that the patient would find this difficult, and the patient would have, be still really struggling with the process. And I realised that they weren't, and that people do actually recover well from cancer care, something like that. I felt, again, emotions are one word. Look up the wheel of emotion if you're trying to identify some of the things that you felt. And that affected my behaviour by, thinking about the way that you actually acted in the session, or even the way that you might act in the future. When you're asking questions to the patient, did you notice anything about them? The patient seemed pleased when you were asking questions, or the patient seemed pleased when you showed empathy, or the patient seemed puzzled when you asked certain questions, that kind of thing. In hindsight, the key issue was, so you might have think back and say, right, the key issue we can notice now is A, B, or C. A better option would have been something, because again, this isn't about the patient's care. This is a better option for the way that you maybe talk to the patient in the session, or the way that you listened. That's what we're looking for. It's okay to say that I should have listened more, or should have been thinking more about the emotional side and less about thinking about the drug side in this type of exercise. And why that would, say, be important. It's okay to see mistakes that you made, and in fact, that's part of learning. Yeah, so we're trying to get you to think about the causality. Think about the way that you felt at the time, what impact that had on your behaviour, what impact it had on you reflecting upon the session now, and then what learning you can take forward from that. Some things that you might want to think about in terms of what to reflect on. Rapport and empathy. You might find it very easy to create rapport with a patient. You might actually find it quite difficult. You might find it easy with some patients and not with others. You might have found it maybe more easy or more difficult because you were doing it with your fellow students, with colleagues in the room. You might think this would be easier if it was one-on-one. I guess with interactions with patients, very often there are other people in the room. You can think about that rapport and that empathy, whether you were able to do active listening or whether it was difficult because in your head you were thinking about all the different assessment protocol, and you're thinking about the patient's treatment and the patient's drug history and the patient's potential diagnosis and all these sort of things. Maybe because of that you found it difficult to listen. Reflect upon the type of questioning that was used by yourself and also by your fellow students, but again, not in name. Sometimes open questions, sometimes closed questions are useful. This type of session, we're probably looking more for open questions. Did you find that hard? Did you find it easy? Do you know what the difference is? Do you find it difficult to remember when you would need one and not the other? Were questions paced appropriately? Did you give patients time? Were any questions leading? Were any questions have been better phrased a different way? Uh, Structure. Could you have structured the session, the interview, in any better way? Did you use summarizing of what the patient said at all? Um, Summarizing is something that is very important to show that you're listening. It's a very important skill. It almost forces you to think about what the person is saying. Did you respond to the patient's emotions well? Did you respond properly? Did you find that difficult? Did you find it easy? Was there an understanding of language between you and the patients? Did you find it hard not to use clinical language? Did you use the appropriate language? Um, was all of this communicated well? Was there any need to check the patient's understanding? Was there any point at which you thought the patient didn't understand the question properly, or what you meant? And then did you let the patient talk, or did you change the question slightly, or how did you deal with that? There's obviously the team element as well. So do you feel as if as a team you worked well? Do you feel as if turn taking was done appropriately? Do you feel as if you responded well to peers and supported them, or was it really three or four separate conversations going on with the patient? Um, and also your internal process. Any any reflections upon that? You don't need to cover all of these, and you won't have time to do it. But choose the ones that you think are most relevant to you and most relevant to the experience that you had with the patient. If you're looking for an example of what a good script sounds like, this is some ideas here that you might think about. When the patient described something, I noticed I moved quickly to problem solving. That likely signaled discomfort with the motion. The patient's tone flattened and we lost depth. Something like that. Shows that you're kind of observing what's going on. You're showing that you're interpreting it, and then you're kind of thinking about what happened, and you're kind of evaluating it by saying something like, next time I'll aim the emotion. That sounds hard. That sounds difficult. That sounds like you're feeling angry. You were feeling angry. That sounds like you were feeling anxious. And then pause and ask an open follow up. If I practice this by talking like this with patients, then I know it's working. If the patients are finding the experience more enjoyable, more enjoyable. Okay, so the change that you're going to make, the changes that you're going to make, it's useful if you think about them in terms of SMART goals. Um, something like saying I will be more empathic is a bad change to make because it's too vague, it's too general. Something like, with my next 3 patient conversations, I'll use at least 2 reflective statements and 1 summary before moving to advice. I review my notes after each and write 1 sentence on what changed in the interaction. This is a really good kind of example of actual change that you could implement and show that you've done something different. Obviously, in this, we're thinking about professionalism. It's a non-negotiable. We're not asking you to name the patient, okay? We're not asking you, and you won't know their date of birth or any kind of specific rare details, probably. But if for whatever reason that came up in the session, don't talk about it. You can just refer to the patients by their first name. Keep your descriptions general. Again, we're not looking for these videos to be used to identify people. Focus your behavior and learning on not judging the patient. Okay, so obviously you're not reflecting on whether the patient did or didn't deal with something that you think they should something well. You're not reflecting on it whether you think that they should have done something differently. That's not what you're here for at all. Obviously, your language has to be respectful. If in doubt, remove the detail. You can reflect without really revealing anything of detail. You can just use your phone. Obviously, that's okay. Looking for kind of for kind of clear audio. If you have a stand, that would be good for your phone. If you don't worry about it, you can just prop it up on a desk. You can use a laptop if you have one as well to record. That's absolutely fine. We also don't want it very long as well. Polished delivery helps you helps your thinking come across clearly. Okay, so a little checklist before you submit. We want a clear structure. We want at least one challenge, what you learned. Uh, we want at least two specific changes you'll make. And forget about the concept and the concept slash framework. Apologies for that, shouldn't be in there. Confidentiality preserved and a professional tone. And that's pretty much it. Okay, good luck with it.